Good morning. Welcome to the Community of Policy Professionals webinar on the pitfalls of delivering policy and how to avoid them. I'd like to open by acknowledging the traditional owners of the lands on which we are meeting today and show my respect to elders past, present and emerging, as well as extending a warm welcome to any Aboriginal or Torres Strait Islanders joining us today. I'd also like to welcome our presenter, Peter Ryan. We'll be hearing from Peter shortly and there'll be a Q&A session at the end. You can participate in this by posting questions in the chat with all, and at the end of the presentation, I'll facilitate questions to Peter. Peter has qualifications in health and has worked in the private and public health systems as an academic and in the public sector. He has developed expertise in delivering strategic priorities, including closing the gap, state plans, child protection reforms, NDIS, and as a founding member of the Premier's implementation unit, working on the Premier's priorities. I'm sure you are all keen to find out about Peter's pragmatic insights for translating policy into practice. I'll hand over now to Peter.
The pitfalls of delivering policy and how to avoid them. So this framework is one that I've developed in my 10+ years of developing and delivering policy in government, and it reflects the learnings and insights from the challenges and successes of delivering policy. The 5 components, I believe, are pretty self-explanatory, and I'll be speaking to those in this presentation. Just to briefly touch on the surrounding principles. Clarity and simplicity, particularly with regard to both design and communication, are critical. It's easy for policies to be overly complex and essentially trip over themselves. Clarity and simplicity in communication, particularly to senior stakeholders through to senior executive and government. In the Premier's implementation unit, we had a saying, we talked about make the complex simple and the simple compelling, and we found that when we got close to that, our communication was most effective. Agility, being able to respond to changing circumstances and iterate is absolutely critical. Set and forget is a path to failure. Routines and maintaining momentum. It's been my observation that the bigger the organisation or the bigger the policy or both, the harder it can be to gain and maintain momentum. And that maintaining momentum in terms of establishing the policy, the programs and obtaining results is absolutely critical to success. And routines, whether it be routines in governance, routines in monitoring and reporting, are absolutely critical in building and maintaining that. And I'll speak to that during the course of the presentation. And of course, collaboration, critical for so many initiatives of any scale. Stephen Covey, in his book, The 7 Habits of Highly Effective People, has a chapter begin with the end in mind. A great read for any of those who haven't read it. With respect to policy, it's been my observation that policy can be funded in 3, 4, 5 year periods typically. And while 4 or 5 years at the beginning of a policy cycle may seem like a long period, it in fact can be a remarkably short period of time. Factors that influence the relative length of this of a policy and your ability to implement and measure can be the frequency of the data that's available. If you're working with annual data, your ability to measure success is immediately constrained. When the data is released with reference to when your reporting windows are, can also make significant influences. A good example of that is NAPLAN data that is typically released at its earliest in September and often final data later in a calendar year. And so therefore, with reference to financial years or other, it can compound, the data releases can compound and really shorten your opportunities for reporting. To design and implement your interventions, to measure and modulate those interventions, and really start building out a data trend in understanding success. You can find that you really only end up with with 1 or 2 years of good solid data before it's time to report. So I really encourage you, when building out a policy, to think about when and how you'll be in a position to report and get that, particularly that really important trend of performance. I'm going to start with number 3, focus interventions. It's my observation, there's really 2 ways that an organisation can work toward an outcome. A fairly complex, dare I say, a messy or unclear path to an outcome. To use a sporting analogy, or a more intentional and clear-cut path toward an outcome. Again, a sporting analogy there. So the earlier state plans set targets for agencies, but without necessarily any agreement as to how those results would be obtained. And what I saw in my work in that is that teams within agencies would pile on to the outcome, indicating how they might contribute. The result was many people were claiming a contribution, but few were willing to put up their hand with accountability, and it was unclear as to the major or the significant outcomes, significant interventions that were most likely to make the biggest difference. And with reference to the second model, it is akin to this, the outcomes framework, otherwise known as program logics, logic models. They come in various names, and but really what they are trying to do in essence is achieve clarity through a few key steps. Firstly, the need to prioritise and define the need or issue that you're looking to resolve, and translate that into a simple, clear outcome statement. They're then looking to break those high-level needs or issues down into more specific objectives, and understand what the outputs might be from any interventions. And the interventions are critical in avoiding the pitfalls of delivery. What are the interventions? Are they meaningful? Are they practical? Do they align with fidelity against the need or issue? And therefore, are they going to deliver in accordance with the outcome or the desired results? Program logics, logic models, etc. There's different terminology that's used. I'd encourage you not to get hung up or too hung up on the language, and really looking at the principles, ensure that you're picking off on the key steps, that you're rigorously defining the need or issue, and have that translated into clear, simple results, and moving and breaking that down into objectives and outputs, but critically looking at what the interventions are and agreeing that they're suitable interventions that will really deliver on the policy. So I think another pitfall that I've seen is that people can tend to view that the outcomes logic as an end in itself, and we can really take our foot off the gas with regard to implementation and driving the establishment of the actual activities that will solve or deliver the results. An outcomes framework is not an end in itself. In looking at interventions, another pitfall is that there can be a tendency in government to want to boil the ocean with the perfect intervention. Unfortunately, these are often the high impact, high effort interventions, and they may not always be readily available for a number of reasons, and I'll touch on those in a moment. So I'd encourage you to come up with and consider a suite of interventions. There may be low impact interventions, but at low effort, it may be possible to get those up and running in days or weeks, and that's great in terms of building sense of purpose and self-belief in project teams, and it's great for building confidence with senior executive and government. High impact, low effort are fantastic. If they're available, they're obviously the highest priority, and then there's the tough but worth it, high impact, high effort. An example, perhaps of that might be an obesity tax, as it's known. Last I looked, I think there were 28 instances of jurisdictions using with an obesity tax, but one doesn't exist in Australia, and it can be that high effort with regard to political appetite and various other things that can impose on the ideal solution. Focused interventions are, I believe, a critical component of avoiding the pitfalls of policy delivery. A defined set of interventions that can gain and attain the attention of or maintain the attention of senior decision makers and have their sponsorship, where the contribution of those key interventions is known, and that is where the significant effort is applied with reference to implementation, tracking performance, iterating as required, and understanding how delivery is tracking with reference to the desired result. So a key factor there, that's certainly something that the Premier's implementation unit and their deliverology method is based on, is the defined set of interventions. It's the critical way, I believe, to gaining and maintaining momentum, and I would strongly encourage you, when looking at a policy challenge, to narrow the scope or keep the scope contained to a small suite of interventions that can be managed and tracked. With regards to interventions also, there's delivery risk, and there's really three types of interventions that are to consider. There's what I call transactional. They are where the service is often relatively simple, particularly in terms of what's expected of the customer. An example may be obtaining or replacing a driver's license. While the back end may have some complexities, the outcome is typically certain, and from the customer's perspective, their behaviour is relatively simple, and the nature of their request is easily defined, and so it's a relatively low risk intervention. Those services that can be more complex might be a complex service system. I've got the conceptual map there of a train system. I think it's the London Underground, but a complex service system like a train system is a good example of a system that's quite complex, but again, the customer behaviour is often quite simple or relatively simple. Moving on to even more complex is where the service system may be ill-defined, and that might be something like a system around mental health services or domestic violence, where there's multiple jurisdictions, multiple agencies involved. The complex service system is further it then has to interface with the complexities of people and their behaviour, where there's challenges around engagement, their knowledge, the ongoing activity, and their motivation potentially. The icon that I've got here is from the Life Unit campaign from some decades ago in Australia, but well advertised, but it was very much an advertising and communication campaign of significant implementation. So they're the three broad types of programs or interventions that I'd put to you and ask you to or suggest you consider in considering the risks and which of those you might be looking at implementing ahead of launching.
Okay, clear targets. So going beyond simply talking about an outcome and having really the courage and conviction to move to a target is a great step. And in doing so, it's really critical to pick out and have a quality target. Poorly set target can be as unhelpful as not having a target at all. So some components from hard learned experience around target setting. They typically, for high priority or high profile areas, will have some sort of proxy or a moniker around them, closing the gap, bumping up education results, or examples of protecting our most vulnerable children. They're all examples of priority areas or policy areas where there's that caption or description around them. Sitting underneath that, though, there needs to be a quality target, and there are 4 components to having a quality target: a baseline date and baseline performance, and likewise a target date and target result. It may sound strikingly obvious, but my experience when I started work on the first state plan under the Liberal government in 2012 was that we had approximately 50 targets, I think, that were missing critical components to them, and we were therefore just not in a position to measure how we were going, either because critical baseline data was missing or, in fact, future performance data was missing in terms of either a date or a result. So if you're involved in target setting, keep in mind that there's really 4 components that are absolutely necessary if you want to have a useful target. There will also, of course, need to be a measure, a defined measure, and this is where your data people will come in terms of how you actually go about measuring the progress toward that target. And there should also be some scope in the form of counting rules and business rules that includes exactly who is in and who is out of the target cohort and why. So important to understand that. There will always be limitations around a measure, and talking to your data people and really defining and understanding exactly who's in and who's out is really important. So just some pointers there as well on target setting. Ideally, they're client-centered, referring to your core business. They're in plain English. And another pitfall within target setting is the use of relative percentages. So yeah, I'd encourage you to stay away from percentages when you're talking about targets generally. Ideally, a baseline metric will talk about actual performance and future performance. But if that performance is in fact measured by percentages, and it might be, for example, the percentage of children in the top 2 bands for literacy or numeracy, it can be a tricky thing to talk about that in terms of both in terms of future results. The best way to do it is talk about the actual result you want rather than a percentage uplift. To talk about a baseline percentage result, for example, 35%, and say you're going to boost that by 8%, can be quite confusing because it can be an absolute percentage, as in percentage points, or relative percentage, 8% of 35. So it can be quite confusing. So just caution you, if possible, to stay away from the relative percentages. Okay, if you're setting a target, there's going to be historical performance. So when we were involved in developing the second round of Premier's priorities, we had the Premier's implementation unit had obviously been around for the first period of the Premier's priorities. And so we were in a position to be involved in the conversation around new priorities and new targets. One of the reflections, particularly when we were considering keeping some of the priorities for a second term, for example, the education priority, we were very mindful of historical performance. And so historical performance is particularly when obviously there will be a baseline, but the media and the public will be aware of historical performance that predates just the baseline. And it's important to understand and contextualise the nature of the outcome that you're wanting with reference to how the organisation, the population has been faring up to that point. So in target setting, it's important, I think, firstly, to avoid setting a target where BAU would get you there anyway. So that the heading here on this slide is a meaningful target should break BAU. You don't want a target where if you've done nothing, you're going to achieve that result anyway. It's obviously what we call a soft target, and can only affirm a degree of cynicism that might exist in the public around the value of a priority area in the first instance. The second area is in terms of setting more ambitious targets is if you hit a target, there can be then the expectation, I think quite rightly, that you're going to maintain that performance threshold. So look, a simple example might be on-time train running for a transport network. If you're going to hit a performance threshold, are you able to maintain it? Again, hitting a target 1 year out of 4 or 2 years out of 4 can be something that can be difficult to manage, but again, may not be great in terms of building that public confidence in the sector and what you're trying to achieve. So think about targets really as a performance threshold, and in setting a target, asking yourselves, if we are aiming for that target, is it something that we can not only hit, but in fact sustain? Okay, so moving beyond the individual target, just looking at the concept of outcomes maturity or within your policy area or a suite of policies. We've talked about focus interventions and having a number of interventions that ideally have targets. The other thing that I wanted to really talk a bit about this morning was the notion that working backwards from those, do the teams involved have targets to understand? It might be deadlines to establish new teams, deadlines to roll out an intervention or training of staff, the number of staff that will be trained in a new technique in support of achieving the target. Working backwards and setting performance targets for establishment of interventions, for the quality operation of interventions, or for early results is a great way to try and cut out the busy work within an organisation and get everyone focused and lined up behind what you're trying to achieve. So a focus or a headline target is really, really critical, but you'll find that within really mature, results-oriented organisations that are high-performing, that what actually happens is that behind that target is a cascade of targets and results and measurable outcomes for those involved with them. So take a moment after the presentation to reflect on whether you're able to quantify or measure your performance of your team or of your group in some way. At the end of a financial year, for example, how does your group or division define its success? It may be in delivering a few some programs or projects, but are there quanta that defines the quality of what you've done and how you've done it? Okay, with regard to focus interventions, I've talked about avoiding the frontal assault potentially on the target that you're trying to achieve, and in fact looking at where and how can the interventions be set up to try and achieve the outcome that you're looking at. So I've put this slide up because I wanted to highlight the importance of understanding the customer journey or the service system, and looking at where and how you can find interventions that will deliver the result that you have. So seeking to define the service system is a really critical component of achieving the policy and the policy result that you're setting out to achieve, and looking at where and how you can be doing things differently. So some service systems are quite well defined, and other systems are less easily defined. That may be complex across multiple levels of government. There may be a combination of both government and NGO involvement or private sector involvement. There can be a number of factors that affect the simplicity or the complexity of a service system and the opportunities to intervene. The service systems themselves, as I mentioned earlier, like a hospital or transport network, can be complicated in themselves. So looking at your service system is critical. And an example from my time working on the Premier's education priority was to look at the service system and reference schools that every public school in the state has a school plan, and to look at and when I looked at the school plan, they have components, they have standard components, and so where and how within a service system can you get the most significant or have the most significant impact is a good thing to start to unpack. So school plans, when I was looking at them, had a few domains, typically around the school environment and the school culture. They would also consider areas around classroom-related activities that might involve lesson preparation, teacher observation, etc. And then there's also, in terms of the customer journey, you could consider the lesson to be the smallest unit in terms of customer journey. And so there's a hierarchy of where and how you can intervene to have greatest impact or effect within a service system. And this is just an example of one to consider. This was one from my time on the education priority, and looking at where and how you can have the greatest impact, and understanding the nature of the interventions for each of those components of the service system and what they'll look like. Starting out on a new policy can be daunting. You've been set a challenge by government to do something different or achieve a different result. You've defined the problem. You've really drilled down and articulated that well. You've then transposed that into a well-defined outcome. You've looked at the logic model, and you've come up with some sensible interventions, a defined suite of interventions. So you've done well to get to that point. It can be intimidating when confronted with a new policy to ask yourself whether, in fact, you're starting from scratch and you're looking at a new suite of interventions, or, in fact, are there things that you can simply change within the service system? So working toward a policy outcome, I think it's helpful to look at, are there some things that, in fact, we can stop? With reference to low-hanging fruit or quick wins, there may be some activity that's not contributing toward the policy outcome that you're after, and may not be essential, and in fact you may be able to repurpose. So are there aspects of service delivery that you can stop or repurpose? Are there practices that you have going on that are good, but in fact could be better? So is there an opportunity to refine? In a number of Premier's priorities, some of the interventions that we introduced were just ongoing training or reflective practice routines, etc., that really just strengthened and clarified the interventions and the work of the staff at the front line. Are there good practices that you can identify and simply expand or roll out further? So are there more cohorts, or can you train more staff and expand something that's already going well? Again, it's much easier to find good practice and expand it rather than to build from scratch. So with regard to the hierarchy of what you're setting out to do and how you're setting out to do it, ideally you're moving to develop a new intervention from scratch, probably as your last option. Wherever possible, think about what you can simply stop, refine and improve, or expand before you necessarily start thinking about developing a new intervention. Another observation when developing policies, so speaking to the front line is critical in understanding the nature of the interventions that you might be looking to roll out. My observation from working across a number of agencies is high-performing organisations. The people within the centre of the organisation, those away from the front line, see themselves as there to enable and empower the front line, not to control or manage. So if you're involved in a policy team or a policy unit at the centre, I think it's really helpful to think of yourselves as there as to enable and empower the front line, and that in seeking to develop new policies and outcomes, engaging with the front line is really, really critical to coming up with effective interventions. Okay, just to speak a little bit about communication. I'm not a communications specialist, but it's my observation that in looking to move to a new policy outcome or intervention, there's really 4 stages of implementation. There's development, there's mobilisation, there's the ongoing delivery of a service, and then there's finalisation, wrapping up or talking about the success of a priority or a policy. So thinking about the 4 stages is really critical in understanding what sort of communication you're trying to push out with reference to the stage that you're at. And likewise, the channel. We're in this era now with many channels of communication, and to think carefully about the best channels that you can have. In transport at the moment, we've been having leader live streams with our secretary, streaming through to the entire leadership team. They've been enormously popular and I think very successful. And in fact, because of the success, our secretary is considering moving to stream to the entire organisation. So really quite exciting and an opportunity for people to hear directly from the secretary. So thinking about the channels and the frequency. So that matrix around communication, with reference to this leadership and communication, the reason I put this together is because the communication that comes from senior leadership is absolutely critical to policy success. The amount of communication and the quality of the communication, particularly with reference to these stages, can be absolutely critical for engaging staff and senior managers around whether the policy is really something that matters, or in fact whether they should get on with their day job. So that's and principles, clarity and simplicity sit there as well. Okay, active monitoring and support. I'm just mindful of the time. It's 10:40, so I'll look to wrap this up soon and move into questions and discussion. But active monitoring and support. I come from a public health background. I've done a lot of study and work with data, and my observation has been that while program evaluation and monitoring are useful, they also have weaknesses. And my observation is that simple, what I call passive monitoring, is not necessarily effective in driving change. And it's really defining what success looks like, both in the outcome with a target, but also defining success in terms of how you're going to get there, what needs to be done, and to be able to report on the critical components. So data is good, but the right data is critical. So so that active monitoring, that real consideration of what performance looks like, going out and collecting that, pressure testing it, understanding the data is important, and support how you go about getting that data is really critical as well. Feeding the data back to the front line so they understand their performance, ensuring that there are systems behind the data to support improvement. Frontline, if you're reporting on frontline performance, and they're getting the feedback and they're hearing that they're not performing as well as they ideally could be or should be, but then they don't necessarily feel that there's the support or the enabling or the training to make the improvements, it doesn't go down well. So that combination of both the active monitoring, defining what you want to happen and how you're going to measure it, and also that support is absolutely critical. So the quality cycle, I've got here just a very simple representation of the quality cycle. I didn't want to create a slide that was too busy, but if you've got your intervention points within the within a service system, collecting that data and then using that data to continuously improve. So if you're refining a service system, or you're expanding it, or indeed if you're doing something new, recognizing that it's not going to operate perfectly from day one. So using that data in a collaborative way and looking at incremental improvement over weeks and months is really, really critical. That's really how I've probably spent the last 12 months in my time at Transport. While on secondment there is really looking at pressure testing, what does performance mean and how do we go about improving it. The continuous improvement is something that I think is critical, and just that recognition, that expectation, building a culture of continuous improvement is really critical for a high-performing organisation, or to achieve a high-performing organisation. Active monitoring, it also includes that engagement with the front line, going out and doing some field work, understanding what where good practice can be found so that you can expand it, or where there's an opportunity to refine it. The communication in terms of a policy, as I mentioned, is absolutely critical in driving towards success. With the intervention, not assuming that an intervention is either delivered or not delivered. There may in fact be a dose, and making sure that people understand what that dose looks like. A simple example might be, for example, counselling. What is the dose of counselling sessions that might be required to achieve the outcome that you're looking for? And defining quality practices as well. Okay, there's a slide there on active monitoring, but these handouts, we'll make sure these handouts are available afterwards. And I might just skip through now and just make sure that we have time for discussion. And at the end, just quickly on governance, it's an area that's often overlooked, or we tend to leave governance to business as usual governance. My observation again has been that if the priority is really significant, you'll set up a dedicated governance group to oversight it, and that governance group will be focused really around the key components of the intervention. So dedicated governance will ideally start and always consider progress against the target. It will consider the communication toward the target, and it will really look at and drill down into the focus interventions. They're three components that I think governance can really do well on if you really want to drive the culture and the focus of an organisation toward achieving its policy outcomes. Simple plans on a page can be great for communicating through to senior governance groups, and the roadmap to success. Just the very simple summary of what will happen across the life of a priority is a really great way of engaging senior decision makers without putting in front of them highly complex project plans or delivery plans. So consider that roadmap as a way of really communicating what's essential in terms of the critical path to success for senior decision makers. Okay, so that's the slides from today. So I thought we might open it up to questions now.
Yes, thanks very much, Peter. That was tremendously rich. I think we'll find it a treasure trove of material that we can delve into over time, and we will endeavour to get your slide pack out to all our participants today. that will help them kind of think about some of the concepts you've talked about. So all of our audience, if you would like to post questions in the chat with everyone panel, if you can find that in WebEx, please do. I know a number of you have found that, and we have a lot of questions already. So we'll get started. One question I'm really interested in, Peter, is I really loved the slide about not everything needs to change. With this hierarchy of stop, refine, expand or develop. But I know that working with ministers and some senior leaders, they want to go straight to the new development, the announceable. So how have you found in kind of taking this much more kind of rigorous approach to people with that kind of ambition? How have they responded when you've tried to take this more kind of rational approach?
So senior decision makers often get really impressed and quite excited by achievement and early progress. And we've, in fact, certainly in the Premier's priorities, really found it a great way to, in fact, build trust and cross that divide through to the political class in terms of garnering trust and engagement around priorities. So I think unpacking and talking about what you're already being able to do, ministers get excited, and I know that there's a number of ministers in our current government who have high expectations for the public sector, which I think is really, really good and really healthy, and being able to demonstrate to them that, in fact, within days or weeks of an announcement being made, that the changes are already happening on the ground is a really great way of building the conversation and the dialogue. And unpacking what the announceable might look and why it might take some time. So, in fact, having that spectrum of interventions can help, particularly if that sort of that slam dunk intervention or that announceable is going to take some time to get up and running.
So it's a good suggestion. I think that would be quite appealing. Like if they can really visualise where we're at now and the forward trajectory, I think that does help build trust and confidence. I'm going to take you back a little bit to probably the outset. I know the terminology for those who are not kind of familiar with evaluation about outcomes and impacts and output. So we have a question from one of our audience members. How is an outcome different from impact and output?
Yeah, look, it's a good question, and I suppose I'll just skip back to the slide. Just bear with me while I do that. I think firstly I would make the point it's really critical not to get hung up on the language, and that's in fact why what I spoke about was delivery, and it's a result. So at the end of a sporting match, there's a result. We know that there was a winner and a loser, or in fact teams tied, but there's a result. Now, whether you call that an outcome or an impact, I don't think really matters, and I'm mindful that there is different language across sectors. With health, I think in public health, an impact is that very long term. In other sectors, they consider an impact to be something quick. So I think that the critical thing is that across stakeholders, everyone knows what you're talking about, and that you, in fact, don't spend too much time on the language. Really, in choosing output and outcome, the output or a KPI is one of those things that is absolutely controllable and tangible with reference to the activity. So there's no ambiguity in terms of measuring the result from the activity, whereas linking that through to an entire outcome can take time. So a simple example might be vaccination. If you've got a viable vaccine, that is one that's been prepared properly and stored properly. If you put it in an output is that you've vaccinated somebody. Now, from that, somebody will either develop an immune response or not. Your ability to control that is less limited. And likewise, building herd immunity is even more challenging because you've got you're reliant on people's behaviour and them coming forward for vaccination. So your ability to achieve the outcome that you desire, which might be herd immunity, what is built on the number of people stepping forward for vaccination, but there might be variables in between that. So think about measuring your activity with a definite result. And I've talked about that as an output. And then you're looking at that longer term sort of result that the government or the public may be looking for, like closing the gap.
You've spoken, I guess, a lot about kind of interventions and the timing and how important they are, I guess. So can you tell us a little bit more about the process that you would go through, or what you've seen has worked well in how to design interventions, and also how to engage others in the design of those interventions, maybe the front line or non-government partners?
Yeah, absolutely. So I think it's critical that there's a coalition of the willing involved in designing an intervention, and that ideally that is representative from across an organisation. So in a school environment, that might involve having representative teachers, senior teachers, school leaders, as well as senior leadership from within a department. It might be within a hospital. It might be having a representative group of frontline staff. I was involved in setting up a chronic disease management program within an area health service. In building that service, we brought frontline workers who were involved in related areas and brought them in to talk about what we were trying to achieve. No one was currently working in, for example, a group that we call chronic and complex care. We were aware that there was a cohort of people that had up to 150 hospital emergency department presentations a year. It was their first port of call when they were lonely or anxious or actually needed health care. Many of them did have complex or health conditions, but none of the practitioners that we were working with actually worked in an area called complex care at the time. But we brought people together who were working in and around that space, including those in the emergency department who often knew these patients on a first name basis. We even knew some of the staff who knew their dates of birth. Likewise, we brought in psychologists who'd been working with people around health anxiety. We brought in social workers who were working in related social service programs, and we brought those people together as a group who could help think through what it might mean to change the paradigm and the current operating model, and build, in fact, what we were calling a complex care stream, which was addressing these frequent flyers.
Okay, so bringing people kind of around the table and clearly identifying the problem and bringing all of those different kind of perspectives to bear on a problem is a good way to identify interventions, is what I'm hearing from that.
Yeah, absolutely. And I think a critical area for success is everyone having a shared understanding of the problem and the solution and the intervention. And I think those having forums where senior people who are hearing directly from government can be at the same table to make sure that in developing solutions, there is that chain back through the seniority, so that there's line of sight to the problem that the government sees or the department sees. So I think it's important that you try and flatten the structure, so to speak, and that you're not simply reporting back up to senior decision makers about how the meeting with the frontline went. Ideally, those people are in that meeting as well, and that conversation is a horizontal or a flat conversation can expedite and build that shared understanding of the problems, the results, and the likely interventions all at once.
Yeah. And do you find that when you do that, the solution becomes fairly apparent to everyone, or at that point, can there still be quite significant disagreements about the policy direction or the target that is should be the focus?
I'm thinking back to the chronic disease program we had everyone around the table, and what we actually realised the problem was the intervention. And it was interesting that in having senior people in the room, we had some of the senior medical specialists in the room, and one of them spoke up and spoke to the data that they brought to the meeting, and indicated that a large proportion of patients currently being treated were being treated contrary to the evidence. So what we recognised the great challenge there was in fact just converting the clinicians to adopt the evidence-based practice. We had to transition patients from alpha agonists to beta blockers for their chronic heart failure. So it was really about changing practices and within so that can be a challenge in its own right, building evidence-based practice and exercise in change management amongst people who think that they've been doing the right thing for a long time. So you can find that, you can find that in fact you haven't defined the need very well, or you haven't defined the output very well, or the result, or in fact you may need to redefine the activity. So you've got to be prepared for those conversations, those broad ranging conversations to in fact pose challenges. Absolutely. Yeah.
Well, it's just turned 11 o'clock, so we fortunately have to wrap up. I thank you very much, Peter, for sharing your expertise and your thinking to date, drawing in so many different types of examples in different aspects of government policy work. So thank you very much. And as I said, we'll try and get the slides out. And thank you for our audience members for participating and joining into the conversation. Also, thanks Indy behind the scenes for helping us set it up. So that's it. We hope that you can join our next webinar in September with Peter Shergold. So if you haven't signed up for that one, take a look in your diary and see if you can join us then. Thank you very much, everyone. Have
Thanks,
a good day.
everyone.